It started in 2015, around November, just having a lot of stomach pain and problems with digesting my food and a lot of bloating, constipation. So finally in 2017, one of my coworkers, just being really concerned about me, suggested that I change gastro doctors. And for some reason, I quickly decided to go ahead and do that. I made an appointment with him, and he ran some various tests that were quite different than the ones that the original doctor ran. And he discovered when the CAT scan came back out of the pelvic area that there was a huge mass, and he said that he was a little afraid that it was cancerous. So my primary care physician, after getting the report, she recommended that I go to Dr. Joseph Santoso.
Fallopian tube cancer, ovarian cancer, and peritoneal cancer, they all have the same symptom, diagnosis, and treatment. So the symptoms, unfortunately, are very, very vague. Like Ms. Pruitt mentioned, it's abdominal bloating. Some people will gain weight, unexplained gain weight. Some people lose weight. So most people don't really pay that much attention to it. I think the key is, if it's persistent, don't ignore it. Do seek your physicians, get ultrasound, CAT scan, things like that. Then we'll identify what's the process. It's not that common. Like ovarian cancer is about 22,000 in the United States. It's high now, but it has the highest mortality because by the time we diagnose them, it's stage 3 and 4. We do not have a screening test for fallopian tube, peritoneal, or ovarian cancer.
After seeing him for the first time, I discovered that that mass was really quite large, almost the size of a football. So then it started resonating with me. He recommended surgery, and of course in my mind I'm thinking with the surgery that he'll be able to just go in, remove the tumor, and that would be the end of it. However, unfortunately with me, it had spread to some other areas, and he wasn't able to go ahead and give me a clean bill of health after that. So he went ahead and removed what he could and told me that we would start chemotherapy. And of course, thinking chemotherapy kind of scary, just not knowing a whole lot about it at the time. But after meeting Dr. Santoso, I really felt that he was as good as people said that he was. The feeling that I got with him, I was very comfortable. I felt like he cared and didn't see me as just a number, another patient to just roll in. And I remember him saying that I'm going to treat you like you're my family, and that's exactly what he does.
About 10-15% of this kind of cancer are hereditary. So do be more concerned if any of your next of kin have breast, ovarian, fallopian tube cancer. Then you probably want to talk and discuss with your physicians about your risk. I think the attitude is very important too, in terms of being positive, and it helps. It's not easy to have diagnosis of cancer, but finding a physician's oncologist that you're comfortable to work with will help.
So I would recommend to anybody, any woman that is having these type of signs and symptoms that don't go away, that are just so persistent, that you would go ahead and see your gynecologist.